Welcome all to today's class. So today we'll be having session on emergency contraception, FSRH guideline. Uh, we begin with our quote, Master MRCOG with concept-oriented clarity. This topic is going to be very important for MRCOG point of view. You will have at least 2 to 3 SBAs and 2 to 3 EMQs from this particular topic. So what are the indications for emergency contraception? Emergency contraception is offered for unprotected sexual intercourse, that is UPC, on any day of the menstrual cycle. And after UPC, from date, so when will you give UPC? From day 21 postpartum, unless there is a lactational amenorrhea criteria. So after 21 days of postpartum, if there is a unprotected sexual intercourse, the patient requires emergency contraception. Or from day 5 of post-abortion, miscarriage, ectopic pregnancy, or uterine evacuation for gestational trophoblastic disease if there is unprotected sexual intercourse and if regular contraception is failed or used incorrectly. So postpartum after 21 days, following miscarriage or post-abortion from day 5 onwards, okay. And if there is a regular possibility that the regular contraception has failed or used incorrectly, she will require emergency contraception. Then provider responsibilities: inform about all emergency contraceptive methods and refer if necessary. Okay, oral EC does not protect against further unprotected sexual intercourse and advise ongoing contraception. We have two methods for emergency contraception. One is a copper IUD, and second is a oral emergency contraception, in which we have LNG oral tablet, and we also have UPAC, that is ulipristal acetate. Okay, so oral and intrauterine devices, out of which oral will not protect against the further episodes of unprotected sexual intercourse. This is only for that particular intercourse, while ongoing contraception will be provided by the copper IUD. So that particular factor has to be taken into account depending upon the need of the patient and whatever is given in the scenario. Okay, and always provide the information on ongoing contraceptive options. Okay, effectiveness of the method: copper IUD is the most effective and can be inserted up to 5 days after unprotected sexual intercourse or ovulation. So this copper IUD is the most effective and it can be inserted up to 5 days. Remember this, they will give you when was the unprotected sexual intercourse. They may give you the length of the cycle, and then you have to calculate the time of ovulation. Okay, if the time of unprotected intercourse is given, whether she is presented within the 5 days of the unprotected sexual intercourse or whether she is in the 5 days of the ovulation, that we have to find out, because copper IUD is the most effective in that particular period. Then coming to the ulipristal acetate, this is effective up to 120 hours. Okay, more effective than LNG EC. Then third one is a levonorgestrel EC. It is licensed for only 72 hours and it is ineffective after 96 hours. Okay, so LNG EC is only up to 72 hours. Okay, and this oral UPAC is effective up to 120 hours. Okay, and this is also up to 5 days. Oral EC is ineffective if taken after the ovulation. So there is a difference between these, that this oral will not be effective after the ovulation, while copper IUDs will be effective up to 5 days of the ovulation. That is why you have to read the scenario carefully and then select the which is the most appropriate in that particular case. Okay. Then coming to the weight and BMI consideration, copper IUD effectiveness is not affected by the weight or BMI. Height, weight, BMI may reduce effectiveness of the oral emergency contraception, especially LNGs. Okay, levonorgestrel emergency contraception will be affected by the height, weight of the patient or the BMI of the patient. Then drug interactions: enzyme-inducing drugs may reduce effectiveness of the UPAC and LNGC. Copper IUD is preferred if suitable. Okay, we will have a separate talk on the drug interactions. But remember, if the patient is on, because this is also very frequently asked question, they will give you that the patient is taking this particular drug, and most of the time it will be anti-epileptic. Okay, so which are the anti-epileptic, which are enzyme inducing, that also you should know. Okay, so 3 milligrams of LNG can be considered, but effectiveness is uncertain double dose of UPAEC is not recommended. We will go into the detail of these particular sentences when we will have the separate lecture on the enzyme inducing drug. Okay, we have that in subsequently. But when the patient is taking enzyme inducing drug, then you have to definitely should know what is the timing of ovulation, when was the unprotected sexual intercourse, then what are the expectations of the patient. Sometimes they do not want anything which is inserted inside the uterus. Then we have only oral option which is present, and in oral option, then we know that the enzyme inducing drugs, then you can give LNG, but you will have to double the dose. Okay, while double dose of UPAEC, so these oral contraceptives will be less effective. In that, what you can do is you can increase the dose of the LNG, but UPAEC dose increase is not recommended. Then UPAEC effectiveness may be reduced if progesterone is taken 7 days before or 5 days after. Okay, so when she is taking emergency contraceptive, that is ulipristal acetate, as an emergency contraceptive, but if she has taken a progesterone in last 7 days, or if she is going to take progesterone in next 5 days, then the effectiveness of the UPAEC will be affected. Okay, so this is about the UPAEC. Okay, that means suppose if she has taken LNG-EC in one cycle and another in the same cycle is required, within the next 7 days, she will not be able to take UPAEC. You can give LNG-EC, but you will not, because this is a progesterone. She has taken the progesterone. So next will not be able to, you will not be able to give UPAEC. Or you have given UPAEC, but she wants to start with some other contraception to be started. But if it is containing the progesterone, then you will not be able to start up within 5 days of taking the UPAEC, because the effectiveness of the UPA as an emergency contraceptive will be reduced. Is it clear to you?
Yes, sir.
Yeah.
Yes, sir.
Okay, so copper IUDs, LNG and UPAC. LNG you can use, the most effective will be copper IUD. Okay, then LNG IUC you will increase the dose, while UPAC the restriction is that you cannot use within 7 days or after. You cannot use progesterone 7 days before or 5 days after that. Okay. Then coming to the contraindications and restrictions, copper IUD, same contraindications as routine IUD. Then coming to UPAEC, it is not suitable for severe asthma, which is controlled by the oral glucocorticoids. Okay, so if the patient is on having severe asthma, which requires oral glucocorticoids, in that particular case, UPAEC is not suitable. Then coming to the breastfeeding considerations, higher relative risk of uterine perforation with IUD. Okay, so if the copper IUD is used, in a postpartum period, there is a higher risk of uterine perforation, but the absolute risk is low. Okay, so what about the oral EC? If she is taking ulipristal acetate, then the breastfeeding should be stopped or avoided for 1 week. Okay, while LNG EC appears safe. So these are the factors, the scenario which will be given to you. You have to take all these factors into consideration, then select the appropriate emergency contraceptive for that scenario. Okay. Then coming to the method selection, the preferred will always be copper IUD if it is suitable, oral EC if IUD is not suitable, and UPAEC is preferred for unprotected sexual intercourse between 96 to 120 hours ago or near the ovulation. Okay, if it is near the ovulation, okay, not after the ovulation, we have just seen that oral emergency contraceptives are not effective after the ovulation. If there is a need of emergency contraception after the ovulation, the only option which remains is a copper IUD. Okay, but if the ovulation is near, then you can use this UPAEC also. Okay, adolescents and sexual assault survivors should be offered all methods. All methods should be offered to adolescents and sexual assault survivors. Now let's see about if there are multiple unprotected sexual intercourse, or if there is a need for repeating the emergency contraceptive, then what does the guideline say? UPAEC and LNG-EC can be used multiple times in the same cycle. Okay, so you can use the UPA ulipristal acetate or LNG emergency contraceptive multiple times in the same cycle. but do not combine UPEC and LNGEC within 5 to 7 days due to reduced effectiveness. We have just mentioned, I have just mentioned you that if you are using UPA, ulipristal acetate as an emergency contraceptive, then there should not be use of any progesterone 7 days before or 5 days after the giving emergency contraceptive. So the same EC can be used or can be repeated in the same cycle, but you cannot give UPEC or LNGEC together. Okay. Then coming to the future contraceptive advice, copper IUD provides ongoing contraception, while oral EC does not. So start hormonal contraception immediately, LNGEC, or after 5 days in case of UPEC. So copper IUD will be ongoing contraception. But for oral emergency contraception, it will not give ongoing contraception. So there is a need for additional contraceptive. Then if we are using hormonal contraception, that can be used with only LNGEC, not UPEC, for up to 5 days. Okay. So if at all it is to be used along with UPEC, then after that 5 days we can use. Then use condom or abstain until contraceptive is effective. Okay. So methods of emergency contraception, what we have seen up till now, there are 3 methods. So one is a copper IUD, second is a LNGEC, and third is a ulipristal acetate. Okay. Now this copper IUD is a intrauterine contraceptive method. LNGEC is a progesterone, and this is a progesterone receptor modulator. Then what is the recommended dose? IUD is retained until pregnancy is excluded, onset of the next menstrual period, or it can be kept for ongoing menstruation. So once you insert the IUD, it should be in place at least till the next period. Okay, till the pregnancy is excluded. And if she wants the ongoing contraception, then it can be continued also. Okay, for levonorgestrel, recommended dose is 1.5 milligram single dose. And for ulipristal acetate, it is a 30 milligram single dose. Then when it is to be inserted, so copper IUD is to be inserted within 5 days, that is 120 hours after the first unprotected sexual intercourse in a cycle, or within 5 days after the earliest estimated date of ovulation. Okay, so you can use within 5 days of ovulation or within the 5 days of the unprotected sexual intercourse. The first unprotected sexual intercourse should be within the 5 days. Okay, then it is licensed, this LNGEC is licensed for up to 72 hours after the unprotected sexual intercourse or the contraceptive failure. While ulipristal acetate, it is licensed for within 5 days, that is 120 hours after unprotected sexual intercourse or the contraceptive failure. Okay, so these are the timing limitations for each. So is it clear up till now? Is it clear? No.
Yes, sir.
Yes, sir.
The same thing is given here, that how will you make the decision? So you just note currently within 5 days or 120 hours since the last unprotected sexual intercourse, the patient is presenting within 5 days of the last unprotected sexual intercourse, then and there are additional UPC in this cycle more than 21 years. So the patient is coming to us within 5 days of the unprotected sexual intercourse, and is there any additional UPC before 5 days? Okay, more than 1 to, if it is not, that means there is a first UPC is within last 5 days, go for copper IUD. Okay, the best is a copper IUD. So if she is presenting to us within the 5 days of the UPC and there is no other unprotected sexual intercourse before 5 days, in that particular case, we will offer copper IUD. If not acceptable, then we'll go for oral emergency contraceptive and suitable ongoing contraception. So is it clear, this particular part? This we have seen. Okay, this, the patient is presenting within 5 days of UPC and there is no UPC before 5 days. Okay, now what if she has got if she is presenting within 5 days of unprotected sexual intercourse, but if there are unprotected sexual intercourse 5 days before, in that particular case, what we are going to do, either it is yes, whether she has got a multiple intercourse before 5 days, or we do not know, but she is currently within 5 days after the earliest likely date of ovulation. Okay, then we will see whether she is within the within 5 days of the likely date of ovulation, then again offer copper IUDs. Okay, so copper IUDs is important within 5 days of the sexual intercourse. Okay, and if there are no other previous incidents of the, and if there is a previous also before 5 days also, if there is a sexual intercourse, in that particular case, note down whether she is within the 5 days or after the earliest likely date of ovulation, then go for copper IUD. Okay, and if we do not know about the ovulation, then consider the pregnancy test. Okay, and if you see in this cycle more than 21 days ago, then offer oral emergency contraception. Okay, so if she is not within in that particular case, what we will do, we will do the urine pregnancy test. Okay, if there is a sexual intercourse more than 21 days ago. Okay, and then offer oral emergency contraception. Okay, then she is presenting to us within she is not presenting within 5 days of the unprotected sexual intercourse, but currently she is the within 5 days of the ovulation. Okay, so currently the last episode is more than 5 days. Okay, that means she is not presenting within the 5 days of the unprotected sexual intercourse, but currently she is less than 5 days of the earliest likely date of ovulation. In that particular case, again offer copper IUD. Okay, this is an oral emergency contraception is unlikely to be effective. Offer suitable quick starting contraception. Okay, now if she is not presenting within this 5 days of the IUCD, and she is not within the 5 days of the estimated date of ovulation, in that particular case, oral EC is unlikely to be effective. What we can do, we can only offer quick starting. Okay, we will only offer the quick starting contraception. Okay, then last one is, we do not know when was the unprotected sexual intercourse, but she is currently within the 5 days of the earliest likely date of ovulation, then offer copper IUDs. Remember, copper IUD within 5 days and of the unprotected sexual intercourse, and within 5 days of the ovulation. Otherwise, you have other alternative. Okay, and if we do not know when was the unprotected sexual intercourse, and she is also not within the 5 days, in that particular case, we will offer the oral emergency contraception and suitable ongoing contraception. Okay, so here, if it is more than 5 days, and here also we do not know ovulation is also she is not within the 5 days of the ovulation, then we will go for oral emergency contraception. Okay, so for oral choice, for choice of oral emergency contraception, we'll see this algorithm too. Okay, so this is what is the choice. Then decision making algorithm for oral emergency contraception. In oral emergency contraception, we have two. One is a levonorgestrel emergency contraception, and second is a UPAC, that is ulipristal acetate. So the for emergency contraception, total 3 options. The first one is the copper IUD. The copper IUD is the most effective form of EC. If criteria for insertion of copper IUD are not met, or copper IUD is not acceptable to a woman, then we will consider oral EC. And among the oral EC, what will be the decision making criteria, that we will see now. Okay, last IPC is within 96 hours ago. What we have seen, the LNGEC is effective for how many hours? LNGEC? Yes,
72 hours.
Yes, LNGEC is effective up to 72 hours.
So up to 72 hours.
Yeah, okay. If there is a last unprotected sexual intercourse within 96 hours ago, in that particular case, unprotected sexual intercourse is likely to have taken place within less than 5 days prior to the estimated date of ovulation. And if it is within the 5 days, then in that particular case, note that oral EC is unlikely to be effective if taken after the ovulation. Okay, so if the ovulation has happened, in that particular case, oral EC is not effective. Okay, then IUCD is taken, unprotected sexual intercourse is taken place within 5 days of prior to the estimated date of ovulation. If it is not, in that particular case, look into the BMI. If the BMI is more than 26, okay, or weight is more than 70, in that particular case, if the BMI is high, UPAEC will be started, and along with the contraception after 5 days. Whenever you will take UPAEC, the contraception will be started 5 days after. Okay. And if the weight is high, in that particular case, what we have to do? We have to use the double dose of LNGEC, and along with the double dose, you can quick start immediately, but not with the UPAEC. Okay. Now, if her BMI is normal, weight is also normal, then we have both the options. That LNGEC is also available, UPAEC is also available. See here, what they have seen. BMI is high, weight is high. In that particular case, they have preferred the UPAEC. If both are normal, in normal case, we have both options, but LNGEC is preferred because you can start immediately. Quick starting contraception is possible, but this is not possible with the UPAEC. So for a normal patient with normal weight or normal BMI, in that particular case, LNGEC along with the immediate contraception will be, or quick starting contraception will be preferred. While if the BMI is high, UPAEC along with the starting the contraception after 5 days. Is it clear, this concept? Okay. The next is,
Yes, sir.
okay, the next one is UPAEC start contraception after 5 days, and LNGEC is unlikely to be effective. Okay. Then this one is the last. When the last UPC is less than 96 hours, if it is not, in that particular case, when was the last UPC? Within last 5 days. If it is within last 5 days, then we'll follow this. We'll go for UPAEC. Okay. That means it is last unprotected sexual intercourse is not within 96 hours, but it is within last 120 hours. In that particular case, we will go for UPAEC because UPAEC is effective up to 120 hours. Okay. And if it is within 120 hours, then oral EC is unlikely to be effective. Okay. What they have mentioned, if it is not within 120 hours, okay, if it is not within 120 hours, then oral EC is unlikely to be effective. Then we will have to reconsider copper IUD. This is also very straightforward. Because of this, yes, no, you might have confusion, but think that if the unprotected sexual intercourse is not within 5 days, then oral EC is unlikely to be effective. This is very clear. Okay. This flowchart is clear?
Yes, sir.
So choosing between the ulipristal acetate and LNG, what we have seen in the flowchart, same thing. What is the effectiveness window? Ulipristal acetate is more effective than the LNG emergency contraception when taken within 120 hours of unprotected sexual intercourse. So UPAEC is more effective than the LNGEC. But what is the advantage of LNGEC? You can do the quick starting of the contraception. You got it? Both are ineffective if taken after the ovulation. Okay. When unprotected sexual intercourse occurred between 96 to 120 hours ago, LNGEC is not effective after 96 hours. Okay, but they have mentioned only 72 hours. Okay, it is not effective after 96 hours. While UPAEC is the only oral option likely to work during this window time. So you have to read the carefully the scenario, the number of hours and all, and the select the appropriate emergency contraception. Okay.
Excuse me, sir.
Yes.
So LNG that mentioned it as 72 hours. Here it is mentioned as 96 hours. Sir.
If you read the guideline, if you read the guideline carefully, it mentions that LNGEC is effective up to 72 hours, and it is not effective up after 96 hours. This is what is the sentence they have used. Okay. And LNGEC is not effective after. It does not mean that LNGEC will be effective before 96 hours also. You got it? The duration which they have mentioned is a 72 hours. Okay. But after 96 hours, but within 120 hours, you only have UPAs. Is it clear?
Okay.
Okay. So let's see, compare the UPAEC and LNGEC. This is up to 120 hours. This is effective up to 96 hours. They have mentioned here, but there is something called as SPC. Okay. what is that SPC is along with every product. There is a leaflet which comes. Okay, summary of product characteristics. So that mentions 72 hours. Okay, so it is effective up to 96 hours, 4 days after the UPC. Okay, but even in the guidelines they have given indicated up to 72 hours. After ovulation, both are ineffective. Okay, when UPC occurred between 96 to 120 hours, preferred option is the UPAC, not effective after 96 hours. Effect during fertile window. Okay, 5 days before ovulation, the most effective, because it delays the ovulation more reliably. It is less effective during this high risk period. Okay, there is a specific reason for this. I will not go into the details of that, but if you read the guideline, it has to do with the LH search. Okay, if you can go through the guideline, you will understand that why this during the fertile window, if she is, the more effective is UPAC and this is less effective. Okay, then further comparison. Okay, starting ongoing hormonal contraception, it is possible with LNGEC, but not with the, you have to wait for 5 days if you at all you want to do the quick starting. Okay, when immediate contraception is needed, it may not be suitable. This is preferred one. Recent progesterone use, again the UPAC is not appropriate. Again here it is preferred. So depending upon the patient's choice, what exactly she wants, along with it, that also you have to take into consideration. BMI we have seen. Okay, with respect to BMI, what you have to do, you have to double the dose of LNG. Okay, and here it may be used, but the data is limited. So this UPAC can be used, but if you are using LNGEC, in that particular case, you have to double the dose or use UPAC. Then use with enzyme inducing drugs. Effectiveness is reduced. Double dose is not recommended for UPAC. But if the patient is on enzyme inducing drugs, then effectiveness is reduced, but you can double the dose of LNGEC. Okay, but success is not certain, or it is uncertain, but you can double the dose of the LNGEC along with the enzyme inducer. Ideally will be copper IUD, but if the copper IUD is not suitable, go for double dose of LNGEC. Then repeat use within the same cycle, both can be used. Okay, but you cannot use one after the other because of the progesterone and the UPAC effect. Okay, then overall effectiveness, this is the most effective overall. This please mute candidate, please mute. Okay, now when to start hormonal contraception after ulipristal acetate emergency contraception? We have seen that the progesterone cannot be used 7 days prior or 5 days after the UPAC. Okay, so if the ulipristal acetate is taken on Sunday, then 120 hours later will fall on Friday. Okay, so I have just taken this particular slide because sometimes they can give you, but what you have to see, you have to wait for 120 hours and then select the day. Okay, if it is a Sunday, then leave Monday, Tuesday, Wednesday, Thursday, and then go for Friday. So 5 days you have to wait. Okay, then time to contraceptive effectiveness when starting 120 hours after ulipristal acetate emergency contraception. Okay, so time to contraceptive effectiveness when starting 120 hours after ulipristal acetate. So combined oral contraceptive pill will take 7 more days. Okay, so 7 additional days you need to use contraception. So first thing, hormonal contraception cannot be started for 120 hours. After that means you will start them after 5 days. Okay, but that contraceptive will further take 7 days for the action. So you need to have additional contraception after starting this particular method. Is it clear what I am saying? Is it clear this particular?
Yes, sir.
Yeah. Okay.
Yes.
So you are giving UPAC. So 5 days you cannot use the hormonal contraceptive. You will start after 5, but that new contraceptive will take another 7 days. So you need to have additional contraception. Okay. Combined vaginal ring, transdermal patch, again 7 days. If you are using progesterone only pill, it or traditional or disogestrel, it takes 2 days to act. So additional contraceptive will be required only for 2 days. So first 5 days to wait, Then next 2 days also additional contraceptive. Then progesterone only implant or injectable is used. Again 7 days of contraception is required. Except Clara, which requires 9 days of additional contraceptive period. So if this particular Clara is used, in that particular 9 days of additional contraceptive will be required. While most of these will require 7 days, except POP, that will require 2 days. Okay. So that finishes the topic of emergency contraception. Okay, thank you.